So I want to welcome everybody to this week's community update. I'm pleased to report that we continue to make real progress with the vaccine rollout this week. We expanded eligibility to several more priority groups, including employees in many sectors who cannot work from home and who are out in the community providing essential services for all of us. We also continued steadily administering more shots. As of today, I believe that we've hit a significant milestone. 200,000 people have now received vaccine in Waterloo Region, and that's about 40% of our eligible population. And based on new data, we continue to refine and make informed decisions that support expanding the vaccine into more priority neighborhoods. Deputy Shirley Hilton will have more details on the plan for these neighborhoods in her update. Sadly, this week, we also saw another COVID-19 related death in Waterloo Region. This is a solemn reminder that while more and more of us are able to be vaccinated, we must also continue to follow provincial orders and all health and safety measures. These protocols are what is saving lives. This week, we also commemorated those who have died, been injured, or suffered illness in the workplace. April 28th was National Day of Mourning, a time to remember those affected by these tragedies. It is, of course, of particular resonance this year as a result of the COVID-19 pandemic. As we continue to forge ahead during the pandemic, the hard work, sacrifice, and collaboration continues within and among our municipalities, community groups, organizations, and neighborhoods. From drive-by parades lifting the spirits up on special days, to new partnerships that support the health and safety of the priority populations, our community has shown we are stronger together. COVID-19 truly is a community story. To chronicle the partnerships across our region, as well as to thank you to all those who have contributed to our pandemic response, regional staff have compiled a story that reflects our collective strength and resilience. You can walk through this collection of milestones and achievements by visiting www.regionofwaterloo.ca/community story. Our hope is that this story makes our community proud and gives our community more hope as we continue to work together and support each other. Hope is on the horizon, in part because of the community groups and volunteers that have stepped up and gone above and beyond for their fellow residents over this past year. We saw an example of this just this week. Residents in one of our long-term care homes in Kitchener who were unable to go outside because of the COVID-19 received donation of coffee and treats from a local Tim Hortons. One resident said it made their week. Let's continue to be kind and support each other in every way we can. I'll now provide an update on enforcement. There have been 46 enforcement actions since the last media update. 42 charges for the reporting period from April 22nd to April 28th, 2021. There are also 4 charges from the previous reporting period that were not reported at that time of update. The Region of Waterloo Public Health has issued 1 ticket to Vivo Pizza and Pasta in Waterloo for failing to comply with a continued order regarding non-compliant mask use. That total payable is $1,130. The City of Cambridge bylaw issued 6 tickets to private residences for gatherings. The total ticket is $880 each. The City of Kitchener bylaw issued 7 tickets to a private residence for a gathering, and those tickets are $880 each. The City of Waterloo bylaw issued 12 charges, 3 tickets for gathering at a private residence, and they each are $880. It also issued 3 summons to appear in court under the Emergency Management and Civil Protection Act for failing to comply with the stay-at-home order. Fines are determined by the court. 6 summons to appear in court were issued under the Reopening Ontario Act for failing to comply with gathering provisions. Fines are determined again by the court. Waterloo Regional Police Services issued 9 tickets under the Reopening Ontario to Ontarians for failing to comply with a continued order for attending a gathering exceeding gathering limits at Trinity Bible Chapel. Waterloo Regional bylaw issued 7 summons to appear in court regarding Trinity Bible Chapel, 1 to the church and 6 to the church elders regarding the organization of a gathering exceeding gathering limits. Fines will be determined by the court. GRT Security issued 2 tickets, one at Frederick Station and one at Ainsley Terminal for failing to comply with face covering bylaw. Those are a $240 fine each. Corporate Security issued 1 ticket at 140 Weber Street East, which is a Waterloo Region housing apartment, for failing to comply with face covering bylaws. That was a $240 fine. Wilfrid Laurier University Special Constables issued 1 ticket at a student residence for a gathering. Total payable there is $880. We'll now move to our weekly updates, starting with our Medical Officer of Health, Dr. Shuli Wong. Dr. Wong, the floor is yours.
Thank you, Chair Redmond. Good morning, afternoon, everyone. So I'll start with overall trends, as usual. So we are seeing some stabilization, but our situation is still precarious, and it will change quickly if we don't keep up with our public health measures. As of April 29th, our weekly incidence rate is now at approximately 95 cases per 100,000 per week. The weekly incidence rate for Ontario is now around 160 cases per 100,000 per week. We are currently managing 586 active cases and 29 active outbreaks. Taking into account interim data, our 7-day average for percent positivity is now at 6.7%. Ontario's is at 8.7%. And variants of concern continue to be the predominant strains in Waterloo Region. What residents can do: limiting mobility and reducing close contacts are critical steps that help slow the spread of COVID-19. Limiting mobility means staying at home as much as possible, avoiding non-essential travel to other regions, areas of Ontario. Reducing close contacts means avoiding social gatherings, keeping at least 2 meters between yourself and people you don't live with. Wear a mask or face covering. Outdoors is safer than indoors. Minimize time indoors with others as much as you can. Employers, please have your workers work from home whenever possible. Under the stay-at-home order, there are things we can all do to protect each other, even during our essential trips. Limit your mobility and reduce your contacts by having only one household member pick up groceries, food, or prescriptions if you can. Trying to plan for what you need ahead of time to limit the number of trips you need to make outside of your home per week. Planning trips or physical activity for less busy times of the day if you can. Maintaining physical distance between yourself and others at all times, even when you have a mask on. And wearing a face covering or mask outdoors when maintaining distance with others isn't guaranteed. Stay connected with loved ones virtually while we are apart. In closing, residents are illustrating their care and support for each other by following the stay-at-home order and practicing the public health precautions. Your efforts are starting to have an impact. I am very grateful, but we must keep going, and we need your help to do it. Stay home, stay safe, save lives. Thank you.
Thank you, Dr. Wong. I've now turned the floor over to Deputy Chief Hilton to give us a vaccine update.
Thank you, Chair Redmond, and good afternoon. Today, we are expecting to reach the milestone of administering over 200,000 doses, as Chair Redmond had already mentioned, of the COVID-19 vaccine to residents within Waterloo Region. This week, we opened pre-registration to the following groups: individuals 45 plus who live in the identified high priority neighborhoods, and for people who work in sectors that fall within Group 2, essential workers who cannot work from home. This group does include essential retail, some manufacturing, transportation workers, and more. A full list of those eligible can be found on the Vaccine Task Force webpage. Beginning Saturday, May 1st, we will open pre-registration to individuals at-risk health conditions. This group does include individuals with diabetes, heart disease, liver disease, and other conditions as outlined by the province and can be found on the Vaccine Task Force webpage. Also, on May 1st, pre-registration will open to individuals 55 plus. Opening pre-registration to additional groups helps the task force prepare for the next group to be vaccinated. Anyone who has already pre-registered who is waiting for a booking invitation will be contacted within 4 to 6 weeks as vaccine becomes available. I also would like to reassure everyone that you will be invited to book an appointment in the order you were invited to pre-register. I do wish to encourage all those groups I've just identified to pre-register for the vaccine as soon as you are able. And when you receive notification to book an appointment, please do so right away. Also, there are many people on more than one wait list to receive their vaccine. Once you receive your vaccine and you have an appointment booked at a different clinic, please call and cancel that appointment so that we can invite others to fill that one. Moving to vaccine supply. Moderna and AstraZeneca continue to be unstable at this point. We do not have a confirmed shipment beyond the May 3rd allocation, but we do see our Pfizer allocations increasing through the month of May. And as we reach the middle to late May, we will see more of Pfizer vaccine. All clinical planning has moved from a steady state of delivery to operating at maximum capacity. This change in planning approach will result in a flex up and down on the clinic operations as required and temporary clinic closures while we wait for next delivery of vaccine. Yesterday, the province did announce and provide an anticipated schedule to expand COVID-19 vaccine eligibility for booking over the next month based on the current understanding of the vaccine deliveries, which is to be further evaluated in light of supply. So stay tuned for further updates while we assess locally. And then in conclusion, please remain vigilant and follow public health measures after you have been vaccinated. Thank you.
Thank you, Deputy Chief Hilton. I'm very pleased to welcome Chief Larkin to give us an update. Thank you for making yourself available about the coordinated approach around enforcement throughout Waterloo Region. Welcome, Chief. The floor is yours.
Thanks very much, Chair Redmond, and good afternoon, colleagues and members of the media. It's a privilege to be here on behalf of the members of the Waterloo Regional Police Service. And as the community is aware, on Sunday, April 25th, after much discussion over the last 15 months, the Waterloo Regional Police Service, in partnership with all of our municipal bylaw units and public health enforcement teams, launched the COVID Integrated Response Team. First and foremost, it's important to recognize that over the last 15 months, we've had a very coordinated, collaborative, and partnership approach to all issues involving enforcement of the Reopening Act of Ontario, as well as the Emergency Management and Civil Protection Act. We have a triaged approach, which manages what agency and policing and or bylaw agency would attend. And for the most part, our members of the community have very much been supportive, have been engaged, and have continued to comply with provincial direction as well as local public health legislation as well as guidelines. However, over the last series of lockdown, we have recognized that our community is facing a series of fatigue as well as a number of acts of civil disobedience. We're also hearing loud and clear from our community that they were expecting more from the police service as well as other enforcement agencies. In dialogue with the Regional Pandemic Control Group and Chair Redmond of the Police Services Board, our police service was tasked with partnering with all of our various municipal partners to look at an integrated approach and an enhanced approach based on community feedback. We went live on April 25th, although we actually started a day early based on current acts of civil disobedience and protest, particularly in the city of Waterloo area using the Waterloo Town Square. And over the last 6 days, we've been involved and engaged in 17 proactive incidences. And as Chair Redmond alluded to, 46 charges have been laid either under the Reopening Act of Ontario and or the Emergency Civil Protection Act. There's a significant amount of work that has been ongoing. The purpose of the COVID Integrated Response Team is to also ensure that coordinated approach. All of us very much want to ensure that we're able to support our healthcare system and those that are involved in the healthcare work. And that's really the emphasis of what we're doing, is actually ensuring that our continued healthcare system has the capacity, has the ability to do the work they need to do to keep our community safe. As we alluded to, we became aware of a series of, over the next 4 weeks, civil disobedience and or protests which are occurring across the region of Waterloo. The majority are currently focused in the city of Waterloo, although they do vary. The COVID integrated response team also allows the police service to continue maintaining effective operations across the region of Waterloo for day-to-day ongoing calls for service and major investigations. And so this specialized team is comprised of members from across the organization that have been reassigned and repurposed over the next 4 to 6 weeks, or until the emergency orders stay in place. They work 7 days a week. There's 4 teams, and they work from 7 a.m. till 3:30 in the a.m. They're also combined with a series of members that are trained in crowd management and public safety to ensure that we can respond to acts of civil disobedience appropriately and with great care to ensure that we manage the incident. Of course, our community has lots of questions around why can people protest and not wear appropriate PPE per legislation and abide by all the rules. This is a delicate balance for policing. It's a delicate balance for public safety. There is a right and a democratic right in democracy to assemble and to protest. Of course, we're urging that during this current state of emergency, and as Dr. Wong has consistently alluded, the challenges facing our healthcare system must be a community priority. So our members do respond. We do ensure that everybody is safe. And in each of these situations, we are taking action. And hence, you'll see over the next several weeks that Chair Redmond will be announcing that sometimes charges are from a previous reporting period as we continue our investigative work. So of course, naturally, last weekend, we dealt with a series of civil disobedience on Saturday and Sunday, where protests did occur. Charges are pending in all of those matters. And then we also attended and supported, in partnership with Regional Waterloo Public Health and Woolwich Township Bylaw, the Trinity Bible Church, where our police service took an enhanced approach to ensure compliance with the Reopening Act of Ontario and the Emergency Management Civil Protection Act. As we head into the second weekend of the COVID integrated response team, we once again will have enhanced plans to deal with pending protests in the city of Waterloo, as well as also continued plans for any acts of civil disobedience across the region. So again, our message remains clear. We're very much committed to the 4 E's. We want to engage our community. We want to educate our community. We want to explain to our community. And of course, enforcement has always been the last resort. But regrettably, some continue to put all at risk. And so over the last week, the 4 E's have in some ways been reversed, where enforcement is part of our approach. We must ensure compliance. We must ensure that our healthcare workers and our healthcare system remains accessible to those that are in need. So again, want to thank all of our municipal partners for this integrated approach. We continue to triage all calls for service. We continue to be complaint driven, but we're also proactive in dealing with planned protest and or planned acts of civil disobedience. So thank you, Chair Redmond. And once again, special thanks to Dr. Wong and all of our amazing healthcare workers for the work they're doing to keep us safe, healthy, and hopefully there is light at the end of the tunnel. So thank you.
Thank you very much, Chief Larkin, for that fulsome report. I'm going to go to Joanna. Joanna, do you have a question?
Yes, thank you. I guess for Chief Larkin first. I know you mentioned that it's a balancing act for police and public health, but would it not be better to shut down these protests before they happen versus laying charges afterwards when people have engaged in behaviors that potentially put the entire community at risk?
Well, again, thanks so much, Joanna. With every protest, we obviously look at the opportunities, we look at public safety, and we also look at the balancing of the constitutional right, which is one of democracy, which is protest. So we do reach out and we do engage those that are coordinating and organizing the protest. We do encourage a deferral. We do encourage them to put the greater good of community. That being said, we're dealing with human nature, and the compliance is not always an option in these pieces. But I think the public needs to understand, and of course, we very much look at risk assessment. And so that when we look at crowd management and we look at protest, we must take a balanced approach around enforcement, public safety, as well as officer safety. And so far, to date, our approach has been to engage, to explain, to educate, and manage. And of course, in all of the protests, I can tell you that if charges have not been laid, charges will be laid. This is not something local to Waterloo Region. We're seeing this across the province. We're seeing this nationally. And I can tell you that all police leaders are very much concerned about large gatherings. But inherently, to simply disperse and or to suppress is not always the appropriate option or the option that makes best sense for all involved. And so it's a very challenging balancing act, but we do want to assure the community that in each of the cases, we're taking enforcement action. And quite frankly, often that is charges are laid after the incident to ensure member safety, officer safety, as well as public safety.
Joanna, would you have a supplemental?
Yeah, for Deputy Chief Hilton. I'm just hoping you could give us a picture of the situation in pharmacies with the AstraZeneca supply. It seems like perhaps the demand has far outstripped what pharmacies are getting.
Deputy Hilton, do you want to take a crack at that?
Thank you. I can start. You know, when we first received AstraZeneca in the community and at the pharmacy level and primary care, obviously the concern was around ensuring people would book at those locations, understanding that we had other locations with Pfizer and Moderna. And through, you know, communication efforts and these community briefings, I think all of the encouragement to get people to go to pharmacy. In some cases, people were able to get appointments much sooner in pharmacy than they were perhaps at one of the other clinics, but no different than what we had seen with Pfizer earlier on in the rollout plan. AstraZeneca has, you know, no line of sight in terms of next distribution to the region, let alone within the province. So, you know, all I can say is I'm happy to see that people had chosen to go to other locations to get their vaccine and that there was an uptake in that. But there's no line of sight, whether it be through public health or through the pharmacy distribution as to when we'll see more AstraZeneca.
Dr. Wong, did you want to contribute?
Yeah, just briefly. So the AstraZeneca supply, as Deputy Chief Hilton mentioned, is unstable. And so you know, a few weeks ago, we started to receive AstraZeneca, which is distributed by the province to pharmacies, so it isn't through us, for our pharmacies, as well as for some primary care practices. And we had a good supply coming in for that one time. And the uptake has been terrific. So it's been pretty quick. Really since the age eligibility dropped to 40 and over. And so, yes, so it's being used up very, very quickly. And as Deputy Chief Hilton said, there is currently no line of sight for the next delivery of AstraZeneca. But as you may have heard, the province is launching a pilot in Toronto and Peel to provide pharmacies with some allocation of Pfizer going forward. So that pilot will happen for 3 weeks there, and then they'll see, you know, about potential expansion to other areas. So there are efforts to try to provide some supply in the midst of instability of vaccines like AstraZeneca in terms of deliveries. To pharmacies in the future.
I think we lost Chair Redmond. Nicole?
Hi, good afternoon. I want to ask about workplace outbreaks. They now account for 60% of the local outbreaks. Are you considering perhaps a Section 22 like they have in Peel if there's 5 or more cases, you know, the workplace location may close down? And, you know, is there any talk about further enforcement in workplaces that aren't following, you know, the COVID rules, more charges per se?
Yeah, thanks for the question. So it's expected that in the settings that remain open, there are more cases that appear. And in a minority of those situations where there are workplace, or rather there are workers who have COVID and who go to work, there are outbreaks that are declared in those workplaces. And most of the time, they are due to sporadic instances of worker to worker transmission, most often, usually associated with inconsistent or no masking or distancing during lunches and breaks and carpooling. So that is expected, and we have to keep reinforcing the importance of keeping up with all precautions in all workplaces at all times. In terms of every workplace outbreak, we investigate all of them, and we put in place measures with the workplace to prevent ongoing transmission. So sometimes what happens in a workplace outbreak is, you have a sporadic incidence of worker to worker transmission, and there's a few of them. So you first detect 2, and then you do enhanced testing to make sure you can get everyone else that may have been exposed, and then you end up with 4 or 5 or 6, but it doesn't mean that there's ongoing transmission necessarily. What it often is related to a sporadic incidence, and then you're detecting more cases with enhanced transmission. But measures to slow the spread have already been put in place. In terms of whether we will enact closures, partial or full closures, that is always an option that is available to us, and that is an option that we will implement if it's warranted, if the measures that are being put in place are not sufficient to stop the potential for spread, or if we feel that because there are a large number of cases, we are going to need to implement a measure like temporary closure to be able to better investigate the situation. If those conditions are met, we will implement those measures. So we have a suite of measures that we can implement for workplace outbreaks, and we will implement them as appropriate. The situation in Toronto and Peel, I have to say, is extraordinary. They have rates that are 3 to 4 times ours, and they have multiple situations where they have so many cases coming in, and they need to be able to investigate the cases well, and so they are putting in a more systemic process to close workplaces. But having a systemic rule like that isn't something that we feel we need to do at this time. There can be very significant implications for systematically closing a workplace just because a certain number is reached. You could have some serious unintended consequences from that, and especially if that type of measure isn't needed to control spread. So what we're doing in Waterloo Region, and feel that it's appropriate for us to continue doing at this time, is continuing with targeted measures to specific workplaces as needed. Thanks.
Nicole, do you have a supplemental?
I do, and perhaps Bruce Lochner and Dr. Wong, you both can weigh in. Dr. Wong, you've said that hospitalizations and ICU rates need to come down before there is really any consideration of easing restrictions. But if we weren't accepting out-of-town transfers, how would our local hospitalizations look like? And is it safe to say, because we are accepting a number of out-of-town patients, that it will be a while for Waterloo Region residents to see the easing of restrictions because our local hospitals are now also tending to residents that are not from Waterloo Region?
Well, thanks for the question. A couple of things I would say is that, you know, we do have patients coming in from other places, but we are seeing more and more of our own residents being hospitalized and having to be admitted to ICUs. This is what the hospitals are saying. That is growing, and that is what we expect a few weeks after we have a surge of cases. So the other thing I would say is there are times when we have needed to have our patients be moved elsewhere. So the hospital system, in order to be equitable and to be accessible to Ontario residents, including our own residents, needs to function as one system, right? So that you know, as much as possible, everyone who needs care in a hospital and an ICU can get the appropriate care. So I don't think we should be looking at it as, you know, what if it was only our residents? We may be taking in more now, but later we may need to send our residents elsewhere too. So right now, you know, Waterloo Region accepting cases from outside of our region is saving lives. We're contributing to saving lives in Ontario, and you know, we need to consider the hospital capacity, the health system capacity as a whole, and this will ensure the best outcomes for all of us, including our residents, if and when we should need that type of care. I don't know if Mr. Lochner would like to add anything to that.
Mr. Lochner?
Thanks, Dr. Wong. Great question, Nicole. Lee Fairclough, the president of St. Mary's, updated at our pandemic control group yesterday that they're seeing, as Dr. Wong said, not only more local patients, but patients who are much younger and getting much sicker much more quickly. So admissions to ICUs for young people is something that we certainly didn't see very much of in wave one. And just to complement what Dr. Wong said, we actually are sending patients. If we think of sick kids in Toronto, if we think of McMaster's Children's Hospital, if we think of specialized care, again at MAC or at London Health Sciences, or even into University Health Network in Toronto, we rely on them as much as they rely on us. And it's not just in the future, as Dr. Wong said, it's now. We're sending patients out of this region as well. So we're grateful for their help, and in return, grateful to be able to return the favor.
Thank you very much. Irene, do you have a question? I see your head nodding yes.
Wait, sorry, it came on. There's quite a delay. Yes, is it possible to know how many people were vaccinated at the clinic in Ayr?
Do we have that number separated out? I don't see, did Deputy Hilton get kicked out when I got kicked out? I don't see. She's on.
The joys of Zoom today. Irene, we can get you that number.
Great, okay. And do you know if there are any more plans to have another clinic in Ayr?
Again, I think that's something that gets reassessed, Irene. And it's always subject to vaccine availability. So again, we can get back to you on that one. I think at this time, we're really looking at community pop-ups in our high priority areas. And I think those are the ones that are scheduled. I don't know, Dr. Wong, if you want to add to that.
No, that's those are the general principles that we're following. Yeah.
Okay, thank you. That's it.
Thank you. Tim, do you have a question?
Yes. Dr. Wong, I've noticed something with every wave that we've seen is that as soon as case rates start to fall a bit, I feel like a lot of people in the area is just like, oh, we're getting out of this wave. We're getting out of this wave. But how important is it for people to understand that it doesn't end at case rates and daily case counts, but we also have to figure out ICU and hospitalizations as well?
You know, that's a great question, Tim. And that's why, you know, I'm trying to really reinforce the message that things like hospitalizations and ICU admissions, and deaths, they really climb several weeks and they stay elevated several weeks after the peak of cases per se, and even as case numbers are going down. And we won't be able to care for all those who need hospital care properly. We won't be able to reschedule all those surgeries and procedures that had to be canceled and postponed because we had to free up all those hospital beds and ICU beds because of the influx of COVID patients and other patients who need emergency care. We won't be able to provide proper treatment for all those people until such time as our hospital beds and our ICU beds start to empty. So the COVID situation in our community, as you said, Tim, isn't only case numbers, it's all the impacts of COVID that happen naturally in the weeks that follow a surge of new cases. And we need to take that into account in order to determine where we're at in terms of battling this third wave, and for how long we need to keep up with the measures and with the precautions in order to really give our community the best chance to reopen again in a way that ultimately minimizes the overall amount of time that we will be under these restrictions. Because if we reopen up too quickly and cases go back up again and our health system is overwhelmed, then we're just going to be under restrictions for longer and it's going to hurt more. So really staying the course for now and continuing to drive down those not only number of cases, but those hospitalizations and those ICU admissions. Doing that right now and keeping up with that is our best chance for minimizing the length of the third wave and the length of time that serious restrictions will still need to be in place.
Tim, do you have a supplemental?
I do. And the province announced that there will be paid sick days, but there's only 3. And I know the regional board of health push for paid sick days. I was just wondering, is 3 sick days enough, especially when we're still in a pandemic?
So I don't know if that was to Dr. Wong. It was regional council is the board of health, but push for that, Tim. And I would say that we welcome the movement. We understand from people in the system, they'd like to see more. So we will continue to lobby for enough sick leave and a mechanism that helps people who are essential workers and can't work from home have adequate support so that they feel able to stay home when they're sick, because that's a huge piece of keeping a community spread down. I don't know, Dr. Wong, if you want to weigh in at all.
No, I think you said that very well, Chair Redmond. Thank you.
Thank you. Paula, do you have a question?
Yes. First, for Dr. Wong, Premier Ford has asked the federal government to make people crossing the border, the land border, have to stay in a hotel for 3 days or until they get a negative test result. And we do still see a handful of travel cases in our community. So in light of both those things, I was wondering if you could tell us at all, what are those travel cases that we're seeing locally, and are they causing spread in the community?
Well, that's a good question, Paula. Thank you. So any measures to continue to tighten the border measures are very welcome by myself. We follow up with cases that are from returning travelers in Waterloo region, and the vast majority of time the travelers are complying with the quarantine restrictions. But of course, anytime you have a case, you have a risk of that case transmitting it to others. In the large majority of cases, what happens is that returning traveler spreads the infection to their own household contacts. And and that's unfortunately what happens. So I still strongly do not recommend non-essential travel outside of the region and especially outside of the country. But in terms of contributing to the spread, it's still a relatively small number of travelers, and the vast majority of the time they comply with the quarantine, although they may, as I mentioned, spread it to their own family members, unfortunately.
Paula, do you have a supplemental question?
Question for Chief Larkin, just further to Joanna's question. I mean, it may seem simple to some people that you should be able to lay charges, then and there when you see a protest happening. So can you explain in further detail, like why that lag is happening?
Thanks so much, Paula. Well, there's a number of different factors that we look at. We look at risk assessment. We look at the individuals we're dealing with. We look at the crowd dynamics. These are all things that our crowd management team and public safety team look at. You have to look at the actual, makeup of the crowd, including the actual, the vibe and what the message is. Generally, there's a message of rallying and anti-government. And so, to send police officers into the middle of the crowd to take action could potentially create further issues. It could create further incitement. It could also put the members at risk. It could put other people who are there lawfully and peacefully participating in the protest at risk. And so it's very important that we take a measured, balanced approach. The COVID integrated response team is comprised of members that are specifically trained in major event planning, crowd management, and public safety management. And that's one of the key pieces. And so I understand the frustration of our community. I understand the frustration of our citizens who expect us to go in and disperse. But we also look at the demographics. Many of these rallies have young children, have different demographics, so older adults. And so, all of these things come into our decision making. And again, we have to also recognize that there is a right to protest. There's a right to democracy to gather. Yes, there is provincial legislation, but there's also a charter that allows for people to assemble. And so we find all the different balance points, and we're trying to explain to the community that we want to take a safe, measured, balanced approach, but enforcement is occurring. It may not be visible, it may not be immediate, but I can assure all of you that it is ongoing and we are following up. One of the things that we've been seeing is, particularly in the last shutdown of the province, is that the hostility of the individuals we're dealing with is increasing. And so traditionally, where bylaw teams may have addressed some of these challenges, for safety reasons, our police service is attending follow-up calls and/or calls, which generally would be handled by municipal law enforcement, because the citizens are becoming much more aggressive, much more hostile, and much more confrontational. And so we want to bring an approach that de-escalates, that explains, that engages, but ultimately also enforces. So again, and that's been much of the dialogue around civil disobedience at a faith-based place of worship is, the natural question that I know the police service board receives is, well, why won't the police service just shut it down? We follow process. We follow different approaches. This is no different than unsanctioned events in our region. We take a very balanced approach. And if you look at that provincially and nationally, that's generally the approach that policing takes. We recognize that it doesn't appease all. We recognize that people are demanding more, but we are following the legislation. We are following all the regulations, and we're actually ensuring that action is taken and enforcement action does transpire. So, it's this whole balance piece of trying to explain to our community why we do the things we do, particularly in a time where there's much dialogue around police intervention and how police interact with our community. And so we do want to take a very measured approach, and de-escalation and/or compromise and/or resolution is always the best outcome. Ideally, once again, we want to assure people and we want to encourage people that if you do have disagreement, certainly do so. There's different ways to disagree with political decisions and all kinds of processes. We're encouraging people not to assemble in large gatherings because we recognize, and we're hearing from our public health officials and our experts, that it does put our healthcare system at risk. It does put our community at risk. And quite frankly, from a very selfish perspective, it puts the members that I have the privilege to work with every single day at risk. And so please do your part and ensure that, assemble and or, do not assemble, but and or take political action and or in other opportunities. That's our message, but we want to, also reaffirm that we will be taking action at all protests and civil disobedience. There will be enforcement action.
Thank you, Chief. Is anybody have additional questions? Okay, Paula, go ahead, and then we'll go to Joanna.
Just really quick, for possibly Chief Larkin again or yourself, Chair Redmond, the more than 40 charges that we saw in the last reporting period, is that a record for the pandemic so far? It's
certainly a greater number of enforcement tickets and update that I've given since I've been doing the enforcement. I don't know, Chief, if you could comment. It's a higher number for sure.
Yeah, I think that this is the highest week to week. And, I do anticipate as we shift, Paula, our approach, we're still very much committed to the 4 E's, but we're likely the fourth E is capitalized now. Enough is enough. There's been consistent public information, consistent public education. All of the work that has been done over the last 15 months around education, encouragement, and support is now time for those that flagrantly. And I want to be clear, it's those that flagrantly put other people at risk. We will be taking enforcement action. This isn't, we're very measured in how we do our business. We're very measured in our approach to public safety, but we do have community members that are consistently and or overtly putting others at risk. And we have a responsibility and a fiduciary duty to take action, and that will occur. Rest assured that all of the upcoming planned protests, our intent is, and we are educating and ensuring that those that are organizing are aware that if you do so, there will be enforcement action.
Thank you, Chief. Joanna, you had a question, then I'll go to Nicole.
Yeah, just sort of the dichotomy between you guys saying that people are following the rules and doing a good job, but then we're also hearing this long list of charges and that people are being more vocal and disobedient when they're flouting the rules. So I'm just trying to get a handle on sort of where we are actually in the region. Do we feel like most people are following, or is there sort of a groundswell of people who are no longer obeying the rules?
Chief, do you want to weigh in?
Yeah, I still think the majority of citizens continue to put our community first, continue to put our healthcare system first. And like in anything, there's a human nature or there's a smaller percentage that are either fatigued. And we also recognize that it's impacting people and persons, financial wellness and overall wellness. And there are some that feel that there's a larger discussion to be had about, government legislation. I do believe post-pandemic, there's an opportunity to have all of those discussions, but we're in a state of emergency. So Joanna, I remain very optimistic that the majority of our citizens continue to put our community ahead of themselves. But what we're seeing is a small number of people that overtly and flagrantly are choosing to put others at risk. And that's where our attention is. That's where our focus is. And we've actually heard loud and clear from our community that that's the expectation that they wish to see, is enhanced police visibility, enhanced police intervention. And we're also hearing, generally that they want us to focus on those types of issues. And that's what we've been doing. So So the natural correlation is that, we are taking more enforcement, whereas previously, I would suggest, and, from the information within our service is taken, is we probably focused on the first 3 E's, where there was, engagement, education, and explanation. And rather than enforcement, there was a warning. Whereas now, actually, we've those that, flagrantly are flouting and taunting the legislation, then, we're actually taking action. So hopefully that gives you some insight. I still believe that we're doing well as a community. I still believe we're doing well as a region, but we have a small portion of the population. And in fact, some of the individuals we've charged are from outside our region. And I think that that's always important when we talk about police intervention. Often there's a focus thinking that all of these individuals are citizens of our community. What we're seeing is traveling approaches to garner support for larger challenges and issues. And so, I don't have the list in front of me, but I can tell you that we have charged a number of protest organizers who are not from our community. They're from outside our region. And so you start to see this notion, and, policing in Ontario is very well coordinated, and we're monitoring and we're actively engaging other police services so we all take appropriate action. So thank you.
And just before I go to Nicole, Joanna, the one thing that I would add is in the update that there are many house parties. So in addition to the high profile events that the chief has covered off, and that's complaint driven. And we know that this pandemic has been hard on so many people in so many ways. And when people phone and complain that there is a large house party, that is followed up on too. And these bylaw officers, and with the reinforcement of the police because of some of the receptions that they're getting at the door, I think this partnership, the chiefs provided this leadership at a really important juncture. People are tired. We know that the lockdown and stay-at-home order goes at least till May 20th. And people who are adhering and giving up their freedom for the betterment of the community also are really upset when they see people flouting the rules. So those complaints come in and they are followed up on. So I just wanted to add that component too. Nicole.
Hi, this is going to be a number of questions in one. Wondering if Chief Larkin, you are able to perhaps quantify how many out-of-town individuals were charged, and if any of them are notable politicians who have attended protests elsewhere. Also want to know your take. We know that the Attorney General asked for the doors to be locked at Trinity, and a judge turned that request down. Do you agree with that decision?
Thanks, Nicole. I don't have the actual data of where the individuals are from in front of me, but if you offline connect with our corporate communications, it can assist you with that. At this point, we've not charged any political member from outside of our region or within our region. But again, we continue to investigate, anybody that has been involved and or political affiliations. We are investigating that. I'm always respectful of our judicial system. That is the democratic system we have. And so certainly understand and have read the decision that was imposed by the judge in relation to the Attorney General request. And it's all part of judicial and civil process. And so very respectful of that. The Attorney General is back in court today, once again, looking at advancing a series of contempt motions. And that's all about judicial process, and the outcome of that is something, regardless of what the decision is, one that I respect. But I have a responsibility to work with public health and regional bylaw, and in particular in this particular case, Woolwich bylaw, to ensure, and we've heard loud and clear from our community, that they want to see action. That they've, recognized that there's other process occurring, but now that policing have other tools and other options available to them. I think last weekend we saw an enhanced approach and a proactive approach to sending a message to those that once again flagrantly violate the Reopening Act of Ontario. So we do have an operational plan in place once again for this weekend, but we're also awaiting the court decision today that the Attorney General once again is advancing for action. Again, this This is not unique to Waterloo Region. This is happening in communities elsewhere in Ontario and across the nation. And so police leaders are following and looking at best and promising practices on how to manage those that, flagrantly disobey, and others that believe that lawfully they have the right to disobey. This is the challenges we face. And as a police leader, we're in the middle of that, and we're trying to find the appropriate balance. But once again, I emphasize the work that we're doing is to ensure that our healthcare system has capacity, can provide the necessary support to our community when required, and those that are most in need to receive medical care can access it. I think that that is crucial. We always have to remember what the purpose and mission of what we're doing in our community.
Thank you, Chief. Are there any further questions from the media? Seeing none, I want to thank you all very much for your patience and in your partnership in getting this really important message out. Deputy Chief Hilton had a glitch, was thrown out of the meeting and has not been able to rejoin. So she sends her apologies. And again, if I can just remind everybody, www.regionofwaterloo.ca/community story is a wonderful presentation of all of the milestones that we have to celebrate as a community. So thank you again for your partnership in these important matters. I hope everybody stays safe and has a wonderful weekend. So thank you all for joining us, and Chief, thank you for being our special guest. Take care.